So filler injections, actually they're quite painless, to be honest. There are two ways that we inject fillers. One is with a sharp needle, the other is with a cannula. The sharp needle, we use basically a very small needle, and we inject straight into the skin. Generally, most of my patients don't need any numbing cream or anesthesia because the fillers these days have local anesthetic mixed into them. For the cannulas, these are used for spreading fillers over a larger area so they can spread it evenly under the skin. And these are actually generally painless because the cannula is blunt and it generally slides underneath the skin very naturally. So most patients are very comfortable and almost pain-free during the treatments. Most filler injections carry very little downtime. Certain areas, for example the chin, that carries a little bit of small risk of bruising. But in general, most patients take it as a lunchtime procedure. They can go back to work and normal life after that. Even if bruising, in a very small chance that bruising occurs, goes away within 5 to 7 days. It can be covered up with makeup very easily. There may be some slight swelling over the next couple of days, but this swelling is very minimal and should not be very noticeable. And in general, most patients get by after a filler injection with no problems at all. Well, I would say no, but most of our patients who come back for repeat treatments of fillers come back because they were very satisfied with the results in the very first place. Fillers don't last forever. Most hyaluronic acid fillers at most last you 1.5 to 2 years. And as the amount of filler in the face starts to lessen, you start to lose that volume that we put in the first place, but it's also coupled with natural process of aging, so it's not going to look worse than before, requiring you to put in bigger volumes the next time, but it's just a part of natural aging. Especially if you have had just a sweet amount of fillers, not too much in the first place, it's not going to cause you to look worse after the filler has gone away. Fillers and Botox, when used together, they have synergistic effects. So as I mentioned before, Botox are used to relax lines caused by expressions of the face, and fillers are used to volumize areas that may have lost a certain mass. And these two modalities, when used together, actually give very synergistic effects. For example, the most classic example that I use is around the eyes, where we use fillers underneath the eyes and around the cheek areas to give a bit of volume and hide the dark circles, coupled with a little bit of Botox around the eyes to open up the eyes a little bit. So that gives a very nice freshening effect of the face. And absolutely, these two treatments can be performed together at the same sitting.